I'm currently covered in puppies. I am officially less than 2 weeks out from my next lipedema reduction surgery. The next surgery that I'm having is on my torso and pelvic girdle area. I haven't been able to find a lot of people that have undergone this area because it is one of the less common areas, but I'm just so excited that once I'm done with this, like in less than 2 weeks, I'm going to be 2/3 of the way done with this journey. And then it's just going to be focusing on recovery and living my life lipedema free or in the infancy stages of lipedema. So that brings me to, can the diseased fat come back, or is this a cure? And there is no cure for it. Yes, the fat can come back. However, it's taken me this long to get this progressed. My thoughts are, in my lifetime, I will never be worse off than I am now, should it come back. Another question is, was I awake during the surgery? I thought you could only remove 5 liters if you were awake. In more advanced patients, late stage 2, progressing into 3, I know that the doctors can remove more if they know what they're doing. And that brings me to the next thing that I see, which is what kind of a specialist diagnoses you. Either a dermatologic surgeon, a plastic surgeon, or a vascular surgeon, I believe are the 3. You don't want to go to a surgeon that doesn't do these lipedema, liposuction, reduction surgeries regularly, because it is not traditional cosmetic liposuction. It involves a different skill set. Liposuction is dangerous. Really research the surgeon that you want to use. My surgeon I love, that's Dr. Amron. Talk to patients, and there's so many support groups on Facebook. Advanced Lipedema Treatment has a support group page on Facebook. Just do your research. That's the best I can say. Does insurance cover the procedures? Everybody's insurance is different. Everybody's treatment plan is different. The short answer is it can be. You just have to make sure that you know your plan. Dr. Amron specifically has a team dedicated to trying to get their patients coverage. It's possible to get it covered, but it doesn't always happen that way. Me and other people that are sharing their experiences like I'm doing, we want to get all insurance to be covering lipedema surgeries. It would be so neat. One day it's like diabetes. Everybody knows what diabetes is. If you said lipedema and you didn't get the look, that's the goal. Full recovery, to really see the results, it takes anywhere from, I think, 8 to 12 months. I did experience my first whoa moment. I was walking on the treadmill and I had upped the speed and I worked out afterwards, and I get in the car and I noticed that I didn't have any knee or hip pain. Lastly, I've seen comments like, I can't imagine having this done outside of a hospital. When I had my babies and I was in the hospital, I got no sleep. It's not comfortable. I loved that I could recover in the hotel room and not be in the hospital bed. But anyways, yeah, less than 2 weeks, baby. And I'm gonna be 2/3 of the way done.